Thank you, Mary. Now, it's my role now to pass on the baton to Ray Suarez. Now, Ray has asked me not to spend time telling you about him because I know you know him better than I do. But let me just say, for those of you who don't, that Ray is senior correspondent for the PBS NewsHour. He's also currently hosts the monthly radio program America Abroad for Public Radio International and the weekly politics program Destination Casablanca for Hispanic Information Telecommunications Network. Many of you also knew him in the 1990s when he hosted national public radio program Talk of the Nation. Now, I've got a whole list of awards that he's won and honours that he's received and so on and so forth. But in order to get on with the proceedings quickly, Ray, I think you'd appreciate if I just ask you now to take over. Thank you very much.
Well, thanks for having me and for bringing me to my hometown. Not all that long ago, when the Soviet Union still existed and hurled thunderbolts at the West, saying that workers were oppressed, and not only oppressed by the connivance of their governments, but the fact that corporations oppressed workers willy-nilly, and then Western governments would hurl back thunderbolts in the other direction, complaining about the systems that gave so few political rights and gave such little opportunity inside those systems. And we had this unfortunate situation where people who thought human rights were pretty important were called idealists, and people who weren't willing to bring them up were called realists. Well, the world's changed a lot since then. Do we even mean the same things when we talk about human rights?
I think it's a very good point and question because we still don't completely share what we mean by the agenda of human rights. It was something I struggled with during my 5 years as High Commissioner for Human Rights. I was faced with all these issues, even though it was post the Soviet Union, that human rights are a Western agenda, but the human rights that was used in that sentence meant civil and political rights. And I pleaded and argued with a number of governments of the West, if you like, take more seriously economic, social, and cultural rights if you really believe in human rights, because you will not convince the world of the values if you stay on what is essentially more of a perceived to be a Western agenda for the very reasons of that standoff during the Cold War. And at the same time, I have to say, at local level, with the real human rights defenders, with the real activists, they didn't have any problems. They saw the whole agenda, and they wanted it. And I sometimes, would listen to leaders of countries with poor human rights records telling me, but of course, the agenda you're talking about is not our values. We have our Eastern values, our Asian values, or whatever. And, I must say I handed to Kofi Annan. He made a couple of very strong speeches, probably written by John Ruggie, about, human rights don't belong in any geographical area. But I still do feel that there is a tendency, and it's a notable tendency in the United States, which has not ratified the main human rights instruments that recognize economic and social rights. If you look at the human rights profile, the United States needs to have an internal debate about deciding that it is time to ratify the Convention on the Rights of the Child, and not to be the only country apart from Somalia. And given its leadership, its genuine leadership on human rights, particularly with a Secretary of State like Hillary Clinton, for goodness sake, the United States needs to ratify the Convention for the Elimination of Discrimination Against Women. It's the CEDAW, it's the So all of that would help to have us more agreeing what is the agenda of human rights.
There are many, many more people around the world living under governments today that they themselves have a legal hand in choosing. But there are also countless millions who don't have enough to eat, who live in degraded environments, who have very little hope that their own children will be able to do better than they have. What does human rights mean in those places where poverty is so desperate and so thorough that, yes, they may have existing legal rights, the franchise, the consent of the governed for their governments, but no medical care, food insecurity.
I think that's been at the heart of what we've been trying to do in realizing rights. It's to try to be practical about the fact that the human rights agenda is a tool for better development, to put it in very simple terms. Many countries, most countries in the world, all countries in the world have signed up to some of the human rights instruments, and many countries have signed up to the instruments that you can really work with. But as I mentioned earlier, we've had a tradition of human rights which is one that we need to continue strongly in. It's interesting that Amnesty is the largest human rights organization and strongly linked with the traditional human rights naming and shaming on behalf of political prisoners, no torture, all of the issues of Guantanamo Bay, etc., more recently. And yet Amnesty, and I very much supported this, have recognized that they also need to talk about rights of the poor and how it can help poor people to come out of poverty and to address the issues and to hold governments accountable. And they have a Demand Dignity campaign. And this is something that we have very much welcomed in Realizing Rights and have been very supportive of. And it's partly learning that to advance economic and social rights, you need to also understand that there may be capacity issues at government level. I'll give you an example. I mentioned that we work with Sierra Leone on the health ministry. We're actually supporting through a ministerial leadership initiative Sierra Leone and 3 other African countries and Nepal in helping to strengthen their health ministry. And it's very practical things. The health minister needs to have more support from the finance ministry, and there need to be better lines of communication. It can be as simple as that. But when Sierra Leone last April decided through its president that it was not going to have any longer this very bad image of being one of the worst countries on maternal mortality. I mean, people were using Sierra Leone that 1 in 8 women who became pregnant would die. I mean, that's a terrible figure, 1 in 8. And the president, who's a businessman from a business background, he said last November when I met him in Sweden that he was going to do this. He was going to take a presidential leadership role on maternal health, and we talked about the issues. And he said, I'm not getting full support from the donors. They say Sierra Leone is too poor a country. But he said, I'm going to go ahead because I just don't accept that we can go on with this. And at the end of April, he issued a very strong decree, very widely publicized in the country, that there would be free health care for all pregnant women, lactating mothers, and children under 5. And when I was there with my colleagues in early July, we saw the reality of this. We went to a clinic in a poor part of Freetown where the clinic was overwhelmed by the fact that the numbers had doubled and trebled because there was no more user fees that had deterred the very poor. If you had to pay a fee, you just couldn't go to the clinic. And none of the medical staff, the doctors or nurses, said this is a bad idea. They all explained this is a terrible pressure on us. And in the hospital, you had 2 women to a bed in some cases after delivery because they didn't have enough beds. But nobody said this shouldn't be happening. What I think we need to work out from a human rights point of view is maternal health is not just a health issue, although that was a very significant decision of the president of Sierra Leone. It's also about access to family planning, property rights, permission to leave the home of a woman who may need the permission of her husband, violence in the home, domestic violence. All of these issues have to be addressed. And I think human rights people have to be willing to work at both ends now, not just the addressing of the abuses and violence ends and holding to account for abuses, but also the capacity end and the need to ensure that that countries are held to their commitments to progressively realize the right to health.